Hi, it's Dr. Ron Miller here of cashbasedphysiotherapy.org, and I've seen this a lot online, so I want to offer my advice. I see a lot of new grads that are interested in starting a cash-based clinic, but they decided to work for a year or two, and there's nothing wrong with that. You need to be an expert anyway. So if you're interested in opening a cash-based clinic and you're a new grad, but you decided to work for like a year or two, here are two things that you can do to help get yourself more money and a better salary. One is look at the facility that you're going to work for or you're applying for. See a need that they need and create a program to attract that type of people. So remember, you got to think like a business owner here. When you're sitting in on that interview, what does that person interviewing you want? He wants revenue. He wants to make more money. And you know, if you bring him more money, he probably has no problem with paying you a little more. Think like a business owner. If you can increase revenue to his business, I'm sure he will reward you by paying you more. So create a program, create a running injury program, a tennis program to be able to attract new patients in and create increases in revenue underneath your guidance. And then he would probably develop a system that he would be able to reward you for that. So that's a way that you can make more money. If you really want to throw some numbers at him, I would love it if someone would actually do this. But the second way to do it is to find out what is your average reimbursement in your state. So for example, in the state of Florida, it's $75 in a standard insurance clinic. And find out how many patients they want you to see an hour. Probably going to be like 2 to 3. So anywhere per hour, you could bring in anywhere from $75 to over $225 an hour. And if you know that information, how much should you get paid an hour? Think about it like that. Most PTs are what, making $55, $60 a year to start out with? And if you feel that you could add great value to their team and really be a part of a team and help the owner's vision and make a lot of money for the practice, if you threw those numbers back out of them, you would probably be able to negotiate a much higher rate than starting out at 55 or 60, because if you're bringing in $200 an hour and they're going to try to pay you $35 an hour, okay, that doesn't make sense here. So think about that for a little bit the next time when you're negotiating a contract of, you know, calculate, okay, you want me to see 2 to 3 patients an hour. The average reimbursement in my state is $75. Okay, so I'm going to bring in $75 to $200 plus $225 an hour, and you're going to pay me how much? $35? Yeah, right. Okay, so think about that for a little bit. It's that, or create a whole new program that they don't have, so you can tap into an untapped market and bring some patients in requesting for that program. And those are two ways that you'll be able to make a little more money as you get into the workforce for the first year or two and start planning out your cash-based clinic. So let me know if you have any questions or concerns about that. Thanks again for tuning in. Until next time.